Never.
Okay, so that's the danger with very high insulin levels. The sugar goes in the cells, but there's nothing left over for the brain. And my little cat got kind of weird and stuff like that. Patricia. So, and alpha cells make glucagon. So if there is not enough glucose in the blood, glucagon will cause a breakdown of glycogen stored in the liver, become glucose and conversion of non-carbohydrates to glucose. So there's a nice little balance here between the two. And tell me about diabetes, diabetes mellitus.
Means sweet urine.
Okay, that's a
Sweet urine.
tasting urine, honey flavored urine. Okay.
So
Really?
it's starving amongst plenty.
Yeah, because you have lots. If you
You
don't
have
have
lots
enough,
of
if you don't have enough insulin, you can have lots of glucose in the bloodstream that can't get into the cells. Okay,
Right.
and that's type 1 diabetes. Type 1 diabetes is also used to be called, it used to be child onset diabetes. Okay,
Used to be juvenile.
juvenile diabetes.
Yeah. And that's just almost a genetic predisposition to not be able to
No insulin.
produce insulin.
No insulin.
No, it's probably, we think it's an autoimmune disease where,
An autoimmune.
so your body attacks your own beta cells and destroys them.
Okay.
So it may be like, maybe there's some kind of virus and you attack the virus and your cells look like the virus. So that's what's thought. Okay. So that's type 1 diabetes, juvenile onset. So it's, but people, a friend of mine got it in her late 30s too. But what are the symptoms of diabetes?
Urination.
Lots of urine.
20 liters.
Thirsty.
Thirsty.
Hungry. Sometimes.
Yeah. So you have very thirsty, you're peeing up a storm, but it's sweet tasting urine. I don't think so.
There's not really liquid left.
So anyway, that would be type 1 diabetes. Type 2 diabetes is associated with
Obesity.
obesity. Okay? And so a lot of people I know my age and older are diabetics now. And they may actually have enough insulin, but their cells are less sensitive to it. And sometimes losing weight can make all the difference in the world. Okay? And usually you don't necessarily have to take insulin until maybe later. Sometimes later they have to might be taking it. Okay. And the gestational diabetes happens to people sometimes when they're pregnant. Yeah. Unfortunately, many of those people go on later to get diabetes. And then I told you about metabolic syndrome. Don't forget about
Yeah,
that.
can you talk about that some
But, it's in the book. Where's the book?
And the other diabetes, that's from the cluster deterioration?
Huh? Oh, diabetes insipidus. What's that due to? Posterior pituitary, and or other things. Anyway, you don't have enough. I think it's someplace. So posterior pituitary, not enough antidiuretic hormone. So what's going to happen there?
Edema.
Huge amounts of
Swelling.
urine. I don't think edema. Huge amounts of urine. So you might be peeing 20 liters a day. And it's not sweet tasting. That's why it's called diabetes insipidus. It's just blah. But
Blah.
okay. But 20 liters a day. Yeah.
Just ask Bear Grylls.
And this is metabolic syndrome. Huh?
Sterile fermentation.
do like urine therapy where they drink their urine. Trying to cure diseases. Yeah.
Okay, here's metabolic syndrome. And it increases your chances of things like stroke, coronary artery disease, coronary heart disease, and type 2 diabetes.
They look so happy.
He looks happy because he's been eating a lot. Okay? The risk factors, if you have 3 of the following risk factors, that means you have metabolic syndrome. Obesity,
The waist size.
waist size, yeah. High blood glucose, high blood pressure, abnormal cholesterol. Okay? And you can read more about that if you're watching.
It's just 3 of those 4.
Yeah, 3 of those 4, yeah.
Obesity.
obesity.
And blood pressure.
Okay. So let's move on down. What about on top of the kidneys? We have the
Adrenal.
this is back here too. Adrenal glands. So we have the adrenal cortex on the outside and the adrenal medulla in the middle.
Uh-huh.
Adrenal cortex, what are the zones.
Zona
Glomerulosa.
Glomerulosa, zona
Fasciculitis and zona reticularis.
Reticularis.
And what's the acronym?
Salt, sugar, sex.
So, salt, sugar, sex.
Gluco,
okay.
mineral.
So the mineral corticoids,
Corticoids.
things like aldosterone, okay? And if you have aldosterone, it makes you reabsorb sodium from the kidney tubules. And where sodium goes, water follows it. So what would that do to your blood pressure?
Increase it.
Yeah, if you have more blood volume, that's going to increase your. Okay. And then the sugar would be the thickest one, fasciculata. Things like, when you think sugar, think
It's the
corticoids.
glucocorticoids.
Things like cortisol. Okay, hydrocortisol. Okay. And if you have too much of the glucocorticoids, what condition is that called? Cushing syndrome. That's a round face, moon face, buffalo hump, and red cheeks, thin limbs, big trunk, poor wound healing, lots of things, stretch marks, Cushing syndrome. And usually that's from taking too many glucocorticoids. Okay. And I started to have that when I was taking glucocorticoids. My face got very round. Okay. And if you have a lack of glucocorticoids and mineral corticoids, that's called Addison's disease. You get dark pigmentation, but
Bronzing.
you can get bronzing of the skin, yeah.
It's not all bad, right?
No, it's one of them was so excited because she had bronze skin. And the doctors didn't realize it. They probably didn't know she wasn't going out in the sun, you know. And you can have a drop in blood pressure that's fatal, though. Very serious. Okay. And so that's what President Kennedy had. Okay. And then we have other things like the testes producing testosterone, the ovaries producing estrogen, progesterone, which we'll cover later when we do reproduction. Okay. Have I left anything out that I forgot? Also, we have other organs, you know, like we saw the kidney produces EPO. That's a hormone. Speeds up red blood cell production.
EPO.
Erythropoietin. Okay. We're going to see hormones also coming from the stomach and the intestines and other places, and the heart. That's no, that's the pancreas is here. I think it's supposed to be intestines.
Oh,
Okay, but I'm not sure.
green stuff?
Yeah. I'm not sure what they're trying to show there. They might be trying to show it's called moles, which we don't find. So don't worry
Don't
about
take the
that.
green stuff on the lab exam.
Yeah. Okay. Okay. Let's take a break now. Okay. Take a little break. And here, remember you have a lot of the pictures on the back here.
When you're done with the baby, can you bring it back?
Yes.
I think it's back here. Right here.
Yeah.